Recently, we asked our community a simple question. What makes you feel heard in a medical appointment? We are so grateful for the extensive and thoughtful responses in the comments. If there are any doctors listening, our community of chronic and recurrent UTI patients find these things most important during appointments. Number 1, validation and belief. Patients feel heard when doctors reflect back what they've said, when symptoms are repeated out loud and accurately, and when body language shows concern and not dismissal. Second is continuity of care. One of the strongest themes in our comments was continuity of care. Although sometimes difficult, patients value seeing the same doctor because it means not having to relive their full medical history at every appointment. Patients feel safe when you've read their notes and collated them. The third theme was distinguishing chronic from acute infections. Patients with recurrent or chronic UTI are asking to please stop treating chronic infections like first-time acute infections. When someone has a documented history of infections ascending to the kidney, continuous symptoms or very frequent UTIs, short antibiotic courses, or wait 48 hours and drink some water are not just frustrating, they can be dangerous. Fourth is respect for lived experience. Many patients will come in with a hypothesis, not because they're trying to challenge, but because they live in their body every day. They've tracked patterns, they know what's failed, and they know what's helped. Being asked, "Are you a doctor?" doesn't sound curious, it sounds dismissive. Listening doesn't undermine expertise, it strengthens it. Fifth, many patients want flexibility with their testing and their treatment. Patients want doctors to acknowledge that a negative culture doesn't mean no infection. They want to hear that tests have limits and that cultures can miss pathogens. Patients feel heard when doctors are open to embedded infection, atypical bacteria, advanced or alternative testing, longer antibiotic protocols when clinically indicated, symptom-led treatment and not dipstick dismissal. Patients deserve practical plans and real solutions, not just generic advice. Number 6, safety through documentation. Clear, accurate notes make patients feel safe, especially in emergencies. One patient shared that a doctor who truly listened and documented everything clearly and accurately prevented unnecessary surgeries. If you've gotten this far in the video, thank you, and make sure you share it with someone who you think needs it. Thank you to the doctors who already work in this way. Patients notice and it matters more than you know.